afternoon and welcome to the Brighten Vitality Series, Episode 2. Today we're going to be discussing the relationship between COVID-19, diabetes, and cognitive decline. And so we thank you so much for joining us today, and we'll be with you for about an hour. Today's seminar is sponsored by Brighten Heights. As you can see, three of us have the Brighten Heights background. Brighten Heights is going to be a one-of-a-kind senior living community located in Pewee Valley, Kentucky, which is just outside of Louisville. And it's going to be promoting the healthy lifestyle culture that you're going to be hearing about on today's webinar, as well as on future ones that we host. We are expecting to open that community in 2024, and it'll be geared towards seniors that want to live in a community that is all about that concept. And you can learn more about that community on brightenheights.org, so feel free to go there at any time. Before we get started, I want to cover a few housekeeping items. First of all, if you have any questions, feel free to input those in the chat window. You can do that both through Zoom, if you've joined us through Zoom, as well as Facebook Live or YouTube Live. And you can leave your comments, and Katie Custer, who is monitoring our questions, will ask those questions for us throughout the webinar. So let me introduce myself. My name is Susan Pena, and I am part of the Brighten Heights team that is working on that development. I'd like to introduce Scott Edens, who is the president of Brighten Heights. Scott, would you like to say a few words?
Thank you, Susan. My name is Scott Edens, as Susan said, and I'm the president of Potentia Living, which is the sponsoring organization for Brighten Heights. And glad to be here today, and thank you for joining us. Thank you, Susan.
Sure. So next, I would like to introduce Dr. Wes Youngberg. If you were able to join us with episode 1, then you are not unfamiliar with him, but I'd like to just remind you a little bit about his background. Really, Dr. Youngberg's primary focus is on working with patients to help them with reversing and preventing chronic conditions through lifestyle changes. And he's especially focused these days on reversing cognitive decline as well as diabetes. That's his expertise. He has become certified in what is known as the Brighten protocol, which is really about all these lifestyle concepts to preventing and reversing cognitive decline. He's also an assistant clinical professor for the schools of medicine and public health at Loma Linda University. He is a fellow and founding director of the American College of Lifestyle Medicine. And he has written 3 books. One is called Goodbye Diabetes. The other one is Hello Healthy. And his most recent one is called Memory Makeover. He also speaks regularly and has contributed to publications on these topics. So welcome, Dr. Youngberg.
Good to be here with you, Susan and Scott and Katie. It's a pleasure to be working with an organization that really is focusing on developing a program of excellence for both preventing and properly managing these conditions.
Very good. All right. Well, we are so excited to have you again. And as a reminder, in episode 1, which, by the way, if you didn't catch that, you can go to our website or to YouTube, and I think even to Facebook, and find the video there. But we do have a special tab on our website called Vitality Series, and you will find it there and you can watch it. But the topic for that one was the connection between our weakened immune system and COVID-19. And today we're going to take a step further and really look at the relationships between COVID-19, diabetes, and cognitive decline. So without any further ado, let's kind of get into that. And I think the first place to start, Dr. Youngberg, if you would, is maybe start with describing what diabetes is, how it's diagnosed, and how it's managed.
A few years ago, I had the privilege to actually write a book called Goodbye Diabetes, and recently got involved with an organization called the American College of Lifestyle Medicine, which has for the first time offered a course teaching physicians how to reverse diabetes with lifestyle medicine. And diabetes is defined one way only, and that is by how high your blood sugars are. It actually, the definition of diabetes or the diagnosis of diabetes has nothing to do with the assessment of the causes of diabetes. It just says your blood sugar is elevated. Your fasting blood sugar is 126 or higher. Your 2 hour after eating blood sugar is 200 or higher. Those are two classic ways to define diabetes. More commonly, diabetes is diagnosed with a hemoglobin A1C test, which is a measure of how sugar irreversibly caramelizes or glycosylates the proteins in the blood, in this case, the hemoglobin protein, and causes an elevated level. And that's how much of diabetes is diagnosed. But it's the after meal blood sugar that is the most sensitive, that picks up like 3 times more people with diabetes than the fasting blood sugar or the hemoglobin A1C test.
Okay.
Thank
Well,
you,
very
Dr. Youngberg. Thank you. How about giving us an overview of cognitive decline and how that's diagnosed and how that's managed?
Yes, thank you, Scott. Cognitive decline is actually an extremely common problem. In fact, we know that by age 85, roughly half of adults, even without any genetic predisposition for Alzheimer's, will actually have full-blown Alzheimer's. But there's many stages of cognitive decline that come before dementia or Alzheimer's. And that starts with what we call subjective cognitive decline. It's where we have a hard time finding that word or remembering that name, but if we're given a test, we do really well. We can test really well in any neuropsychological test. We don't have any problem with driving or finding our way around or doing the things that are quite complicated. We're really good at executive function, but we're just not as quick as we used to be. So those of us that can test really well, that are still pretty sharp, but we know we're not as sharp as we used to be, that's what's called subjective cognitive decline. And that's a significant portion of the population, where really all of us after age 40 should be paying attention to that and figuring out what are our risk factors for that. Next comes what we call impaired cognitive function. It's not Alzheimer's. It's not defined as dementia yet, but you can actually test. They're not scoring as high on tests that require executive function or organizational skills, etc. And that's a big portion of people right now that are struggling with cognitive decline. They definitely know that there's a problem. They're still functional though, right? They can still drive a car. They can still cook. They can still, do the things that they need to do during the day. For the most part, they can still, balance the checkbook and so forth. But as soon as they start having functional problems, that's when it gets into what we would call dementia. And so that's why I say the main goal in reversing aspects of dementia is becoming functional again, being able to do things that we should normally be able to do independently at home, but do them effectively, because we've actually helped address the underlying triggers of the dementia. And then there's different categories of dementia. People think, well, do I have dementia or Alzheimer's? And the reality that Alzheimer's is just one of the many forms. There's over 20 forms of dementia, but Alzheimer's represents 80% of all dementia. So it's by far the most common form of dementia. And I've had the privilege to work with people who have Alzheimer's dementia, and by applying principles, many of which we're going to be discussing in this series, by applying these principles properly, we can actually not only slow down the progression of the dementia, stop the progression of the dementia, but many times we can begin reversing aspects of that dementia because they're becoming functional again.
Excellent. All right. So So now on to our topic at hand for today. Is there really a relationship between these three things? Because they seem pretty different from each other. COVID, diabetes, cognitive decline. What's the connection?
Well, it's interesting that there are many, many connections. And as I started studying COVID-19 in depth back in late February of this year, I realized that the most important thing is to optimize the immune system. And as I've been working with dementia or cognitive decline for many years now, I've come to the realization that the most important thing to do in those individuals is to fix an underlying weakened immune system that is allowing low-grade infections, or because of toxins that are damaging the brain, are leading to this cognitive decline. So there's many combined factors that by helping one area, you're actually helping the other. Anytime we improve the condition of diabetes, we're greatly lessening the risk of dementia. Anytime we're improving the immune system to prevent and manage COVID-19 more effectively, we're also diminishing the risks associated with diabetes and cognitive decline.
Well, Dr. Youngberg, if there's a lot, it sounds like a lot of people, are being affected with COVID because of the underlying condition of uncontrolled diabetes. What are some of the other uncontrolled underlying symptoms that would affect COVID?
Yeah, it's you mentioned the underlying symptoms, or another way of saying that would be what is the actual underlying cause of the problem? And as we look at these three conditions that seem so dissimilar, so different, of COVID-19, diabetes, and dementia, we see that one of the primary underlying drivers of all three of these is a condition that we call insulin resistance. Another name for it is metabolic syndrome. It's essentially the reason somebody becomes diabetic is because their body has become very resistant to the effect of insulin. And so even with a lot of insulin being injected or produced by the body's pancreas, the blood sugars still go up. And so insulin resistance has been now noted as one of the main drivers in predisposing somebody towards becoming seriously ill or even dying of COVID-19. One way to evaluate that is that a study done recently by looking at all the deaths that occurred in England, they discovered that a full 31%, almost an entire third of all the people who died from COVID-19 in England had type 2 diabetes. In other words, we've known from the very beginning that people with diabetes are at high risk, but it maybe hasn't been emphasized enough, because a full third of everybody who died of COVID-19 in that study had type 2 diabetes. And I think it's the same worldwide. So, but the question is, what is the actual cause of the diabetes? That's insulin resistance. And so now we're finding that insulin resistance, even in a non-diabetic, okay, which, by the way, there's at least 4 times more pre-diabetics than diabetics. And I believe that if the research were ever to be done on this, we would find that there's an even larger share of deaths due to pre-diabetes, because people with pre-diabetes already have an insulin resistance syndrome. They have this metabolic syndrome where they're more likely to have various risk factors. And because of that, their blood sugar, as soon as they get infected with COVID, their blood sugars go up real rapidly. So a non-diabetic who has a 20-point increase in their average fasting blood sugar is now known to be 2.5 times more likely to die of that COVID-19 disease, that viral infection, than somebody who does not have that big rise in their blood sugars when they get infected with COVID. And of course, that rise in blood sugars because they are pre-diabetic, they are insulin resistant. So insulin resistance is the main driver for COVID. It's the main driver for type 2 diabetes. And it's also well established now to be the main and most common driver of dementia. Okay, and then there's other correlations as well. Just this morning, I got a text on my phone from the Huffington Post, which I get regular updates from the Huffington Post and other newspapers as well. And it basically was outlining the neurologic syndromes that are occurring now because of COVID-19. And we're expecting to see a big rise in dementia and other neurologic diseases because of COVID-19. That's another reason why you want to strengthen your immune system right now. You don't want to wait. Just before coming on to this webinar, I was talking to a very close friend of mine whose mother had COVID and had to be in the hospital because she's a nurse. She was able to be there with her, and she now has COVID, and she has no taste or smell right now, and is all sniffly. And she's saying, "What do I do? Right? What are the right things that I should be doing right now?" And of course, we should be asking that question before we get infected, because really the reality is that everybody's going to be exposed with this, right? That this virus is extremely infective, where we're all going to be exposed to it eventually. And what the determining factor on whether we do well or not is how strong our immune system is. That's the bottom line. So there's many underlying relationships here. And that's why we want to make sure that we're especially working closely with those people who have known risk factors.
Well, very good. I took some notes when you were talking. It was like, wow. The thing with insulin resistance, metabolic syndrome, I've heard those phrases thrown around. And I think probably for most of us, we're like, we hear it, but we don't really know what to think of it. It's like having some, like you used the analogy before about an iceberg, where the portion of the iceberg you can see is very little compared to the majority of the iceberg, which is under the water. And I think that's how you would describe insulin resistance, is it's mostly under the water and you can't see it. You don't really even know necessarily that you have symptoms, but then all of a sudden you've got a problem. That's because you had insulin resistance and you didn't know you had a problem until this new symptoms showed up. So I don't know, Dr. Youngberg, can you kind of describe to us, how we should even know if we should go get tested to see if we have insulin resistance, because it's such a bad thing.
Right. I like the analogy there of looking at an iceberg, right? And so if you're on a boat looking at an iceberg, you see the iceberg, the portion that is sticking above the ocean, the ocean, the top of the ocean. And so you see, man, that's a huge iceberg. But in reality, the 90% of the iceberg is underwater. And so the tip of the iceberg here would be the diabetes, right? The high blood sugars. And so diabetes is defined as really high blood sugar with a fasting blood sugar above 125, or a 2-hour blood sugar after eating above 200. But then pre-diabetes, the next phase down, would be categorized as a fasting blood sugar before breakfast of 100 up to 125. And so it's kind of like an early form of diabetes. It just hasn't quite crossed into full-blown diabetes. Or the after meal blood sugar at 2 hours would be 140 or higher. But that's the tip of the iceberg, right? The reality is that the majority of the metabolic problem is not represented by either diabetes or even pre-diabetes. The majority of the problem is this nebulous term, right, of pre-diabetes or metabolic syndrome. And so essentially that insulin resistant syndrome is where the cells of the liver or the muscles are just no longer sensitive to insulin. So even high levels of insulin are not controlling blood sugars very well. And it's the high production of insulin that sets us up for all kinds of problems, including the dementia. So as I work with my patients, I actually do test for 4 hours. It's a 4-hour glucose tolerance test where we measure blood sugar levels after a sugar drink, but we also measure the insulin response. And we see oftentimes a very high insulin response. High sugar and high insulin response both are extremely damaging to the brain because they allow dementia to develop much more rapidly. Okay, and then the third part of that is that high insulin level allows the blood sugar to crash later on, a couple hours later, and the low blood sugar is even worse for the brain. It literally kills memory cells. Okay, so the goal is to have stability of the immune system and stability of our blood sugars and stability of the hormones that regulate blood sugar, which include insulin and cortisol.
Dr. Young,
oh, I'm sorry. I was going to ask one more follow-up. I've heard it talked about that caramelization process, and I think you've even described it this way, as where it's like a keyhole and a key, and that process basically works it to where the key will no longer go into the keyhole of the cell and unlock it and make it work properly. Is that a fair way of also describing what insulin resistance is?
So yeah, insulin resistance is a great analogy of using the key in the lock analogy, where the key is insulin and it goes into the lock and it unlocks the doorway for sugar to flow from the blood into the cell. Well, in a scenario of insulin resistance, the inflammation and the other factors that cause insulin resistance is kind of like putting a piece of wax into that keyhole. And now that key may fit, but it doesn't do anything. It doesn't work. It doesn't unlock the tumblers. And so now you got blood sugars building up because they can't get into the cell. And in terms of the brain, if the sugar doesn't, the carbohydrates don't cross from the blood into the cells of the brain, those memory cells die. You have to have stability of energy for the body appropriate. And that's why diet and proper exercise, light exercise immediately after meals are critical strategies to stabilize blood sugar, stabilize insulin levels, and optimize the immune system as well.
Dr. Youngberg, you've mentioned, I've heard it several times over the last few minutes, about metabolic syndrome. What is that, and how do we know we have it? And then maybe Katie, you can answer, you can throw in a question after this.
Yeah, thank you, Scott. That's an important question, because again, this concept of insulin resistance is kind of hard for us to really grasp and visualize. So the easiest ways to determine this by getting some of the most basic laboratory tests that your doctor does with every physical. And so the first thing is you can actually do at home is you can basically look at the girth of your stomach, okay, and if the measurement around the smallest area of your waist to your belly button, okay, if that is larger than your hips, then you have one of the main risk factors for insulin resistance, or what we call metabolic syndrome. So greater girth around the midsection compared to the hips is a major risk factor. Number two would be blood pressure. If your blood pressure is even 130 over 85, just a little bit high, not even hypertensive, that categorically puts you into a scenario where you're more likely to have metabolic syndrome. So I'm going to give you 5 different tests that we look at. If you have 3 out of those 5, then that's proof that by definition you have metabolic syndrome. So the third test would be a triglyceride, the blood fats that are part of a lipid profile that you do with your doctor every year. If your triglyceride blood fats are higher than 150, that is another risk factor for metabolic syndrome. If your HDL, your good cholesterol, is less than 45 for men, less than 55 for women, that's the 4th risk factor. And then finally, you have what I would consider to be one of the more obvious risk factors, and that is if your fasting blood sugar automatically puts you into a pre-diabetic state. That means a fasting blood sugar of 100 or more. Then that's that 5th category that qualifies you for metabolic syndrome diagnosis if you have 3 out of those 5. So those are ways that doctors now, after a physical, they have all that information available to them, and they should be talking to their patients saying, you have metabolic syndrome or insulin resistance syndrome, which places you at far greater risk for developing full-blown diabetes, heart attacks, strokes, chronic kidney disease, dementia, and yes, COVID-19 as well. I don't think too many doctors are clued into that at the moment, but there's no question that metabolic syndrome dramatically increases your risk for COVID-19, in particular, Scott, because we now know that the main cause of death from COVID-19 is cardiovascular. It's not a lung problem. It's cardiovascular, where the blood vessels have basically stopped producing the right hormones, and they lead to a clotting state where you have thousands and thousands of these little microclots that go everywhere in the body and damage the kidneys and damage other organs and especially damage the brain. So we're learning more and more about how this, if you end up getting more sick with COVID and end up in a hospital with COVID and ICU, you're much more likely to have long-term complications with your brain health and with problems with cognitive decline. A lot of people are experiencing what's called long COVID. They say that an average of 1 out of 7 people who are infected end up with long COVID. They may not have even had horrible symptoms to begin with, but now they just constantly fatigue, brain fog, which of course is a cognitive problem, is a common symptom. And so we're really concerned about where this is headed. And that is one reason we're doing this seminar series, is the better we take care of ourselves right now, the less likely we are to have long-term complications with not only fatigue, but this cognitive decline in the brain over time.
Great. So we
go
just
ahead.
received a question from someone participating and watching the webinar. She asked, one of her friends has type 1 or juvenile diabetes. So is she someone that's more likely to be in danger than someone with type 2 or adult diabetes?
Well, okay, that's a great question. The research that I cited out of England showed that type 1 diabetics represented maybe 1% or 1.5% of the total deaths from COVID. But we have to remember that type 1 diabetics, for every 4 or 5 type 1 diabetics, there is 95 type 2 diabetics. Okay, so in other words, you're 20 times more likely, population-wise, statistically, to have type 2 diabetes than type 1 diabetes. So that on the surface seems like good news for type 1 diabetics. However, because there's so many fewer type 1 diabetics, the important thing is knowing that the risk of getting bad symptoms from COVID or succumbing to COVID is still very high in type 1 diabetics compared to those without diabetes. Very high, and partly because their blood sugars are more likely to bounce up, or because they need now more insulin. So here's the key. I always tell type 1 diabetics that now are not able to produce their own insulin because of a viral infection or because of a toxin or some injury that basically killed off all the beta cells of the pancreas that make insulin. So but type 1 diabetics can also over time develop type 2 diabetes. Now, it's never diagnosed that way, okay? But by that I mean that they can develop the same syndrome, the same metabolic syndrome as a type 2 diabetic develops, but it goes unnoticed because they have type 1 diabetes. In other words, if you're a type 1 diabetic and you need to take more than 30 units of insulin a day, then you actually have more of a type 2 diabetes on top of the type 1 diabetes. And that's what actually is one of the main risk factors for cardiovascular disease and immune-related diseases as well. So I would say that the same things we're saying to help type 2 diabetics would benefit the type 1 diabetic. Eat healthy, exercise appropriately, get your sleep, all the things that we address, get your vitamins appropriately. We're going to be looking at that as well. And they can be assured that they're at much lower risk, even with type 1 diabetes. Keep your blood sugars in control. That's the key. So if you're a type 1 diabetic, they're checking their blood sugars multiple times a day, before and after every meal. They should be. And if they start seeing a spike in their blood sugar above and beyond what it normally is, that would be one of the first clues, by the way, that they may be infected with a virus. Because that's what happens when you get an infection, your blood sugars skyrocket. Okay, and that's what the body's response to the infection. So that's why you would immediately get full bed rest, drink, do all the natural things that you need to do, work with your doctor to get on the right medicines before, and there's different phases of the infection that have to be treated very differently. There's a viral replication phase. The first 10 days or so is when the virus is replicating. It's actually the first 6 days. And so if you take an antiviral after that phase, it's not going to do you any good unless it does other things as well, because there's no more virus after that period. It's all inflammation at that point. So you need to focus on steroids and anti-inflammatory strategies for the second phase.
Wow. So I know we had a couple comments come up about diet and sweets. I want to have you expand on this, Dr. Youngberg. When I've had to switch my diet around because of issues with arthritis, and I knew there was a direct correlation between my sweet tooth and my fingers, almost instantaneous, it seemed like. I was pleased to at least know that eventually over time, my desire for sweets diminished because I had changed my palate, if you will. I wasn't eating them, therefore I wasn't craving them. Could you kind of speak to that concept about, how your taste buds, et cetera, change over time?
Yeah. So, what's interesting is that when we are more likely to have cravings for sweets and these comfort foods, that's when we're most susceptible. So that should be a clue to us, oh man, I really would like to have that ice cream or that soda or whatever it is. That should be the first clue to us that our body's immune system is already depressed. It's already maybe exposed to something, and the body is looking for a way out, and we want to feel better. And so of course, we in our human rational thought, we think, well, if I'd feel better if I had piece of pie or some dessert or some sweets. And yeah, we'll feel better temporarily, but then that really shuts down the immune system and then it's got us. It's almost like that virus is whispering to us, like it's trying to put us under its spell. And it's interesting how nature works. There's a lot of things in nature where parasites or microbes will actually send signals to the host, to the animal host that they're in, to go do things that is better for them. So they're literally under the control of a parasite. And of course, in COVID and any viral infection, we're to some extent under the control of this virus. And so we have to, it's been said, bring every thought under captivity, right? So, oh man, I'd feel so much better if I had that dessert or whatever. That's basically, think of it as the virus talking, saying like, come on, you know, they're not going to be able to replicate if your immune system kills them. And so they want to live and they want to take over your body. And so that's why we have to use our minds and use our frontal lobes and make decisions that are different than what we're feeling like. Don't follow our feelings, follow the plan of what's best for us. So that would be one of the key things. And yes, you're right, Susan, once we start following our plan consistently, literally within 2 to 3 weeks, the body adapts to the new plan and is satisfied with it. And we're less likely to have those constant cravings for maybe the way we used to do things.
Yeah, I like to say that your body likes what you feed it. So if you change what you feed it, it will like the new thing. So yeah. Question for you. You know, we talked last time about COVID, and you mentioned at the beginning some new study, but are there some other updates on COVID that you have for us since we last spoke?
Well, you know, there's so many studies that have come out. We had talked about a study done at University of Cordoba, Spain, a teaching hospital that actually gave the metabolite of vitamin D to patients day 1 of admission and day 3 and day 7. And it was such a powerful impact that it decreased the requirement of moving on to intensive care unit from 50% in the group not getting the calcidiol vitamin D metabolite down to 2% in those who were getting the vitamin D therapy. And about 8% of the group without vitamin D died, whereas 0% of those with the vitamin D died. So that we had gone over that study last time. Now, since that time, there was another study, a randomized study done in Brazil that seemed to totally flip that around. And in their conclusions, they suggested that vitamin D does not appear to be that helpful in people who are seriously ill with COVID. Well, the problem was with that study is that, well, there's a lot of problems with that study. Number one, it hadn't been peer reviewed yet. It may have been, I don't think it's been peer reviewed yet, but they waited 10 days after the beginning of symptoms, which basically means they've already completely gone through the full viral replication phase. And so it's kind of like saying, well, it didn't help at all. You know, they're saying it didn't help at all. Well, what would help if you wait 10 days after the infection begins? Like and just give one, even if you're using an antibiotic against a bacterial infection, 10 days after the beginning of the illness, and then you only give it once, 1 day, is that going to work? Even if the antibiotic was extremely effective, it's not going to work if it's just given once. So that study has been heralded by some critics of vitamin D as proving that vitamin D is not effective with COVID, which is just simply not true. A better report, a review of this was done by Dr. Roger Schwelp, a professor of medicine at UC Riverside and Loma Linda University in Southern California. and he has he basically teaches doctors who are trying to pass medical boards. That's one of his main jobs. He has this called med cram, so it's cramming to pass medical boards. Over 50 million views on his website. And he came out with an hour-long presentation on vitamin D, which was fantastic. It's available on YouTube, Dr. Roger Schwelt, medcram.com. And he outlined study after study after study after study that documents all the different reasons why vitamin D is so critical. And then another key study that he reviewed as well, that we did not, that is more recent since our last session, is called the SHADE study, which is a study of where they took people who they were positive for COVID, but they only had mild or no symptoms. And here's the key thing that we learned from this study, Susan, is that they actually were given 60,000 units of vitamin D every day until their blood levels of vitamin D exceeded 50 nanograms per deciliter. Okay, so this was a real key study. Okay, and you know, the people are thinking, what, 60,000 units? That sounds horribly excessive. That would cause severe toxicity. No, it didn't. It's really hard to cause vitamin D toxicity. I'll tell you what's toxic. COVID-19, that's what's toxic. And so you need to take enough vitamin D to help limit the toxicity of the virus that causes COVID-19. So here's the key take-home point. Number one, those who took the vitamin D at those high doses for at least 7 days, and many of them for 14 days, discovered that they were able to completely get rid of even the viral particles that make the test for COVID-19 positive within 21 days. So within 21 days, 62% of those on the vitamin D eradicated all signs of even the viral particles. Those not getting the vitamin D, only 21% were able to eradicate the virus completely, the viral particles completely. So in other words, you're 3 times more likely to get rid of any sign of COVID within 21 days if you're on a high dose vitamin D supplementation plan. The other take home message, Susan, was how long it took for the blood levels to get up to an optimal level that is protecting you effectively from COVID. There's many studies now that are pointing out that an optimal level for COVID-19 protection is above 50 nanograms per deciliter. And that's way higher than the average American. In other words, the average American is a sitting duck for COVID. Why? Because they don't have, one big reason is they don't have enough vitamin D in their blood to protect them. It's like you're going out to war, to fight thousands of people on the other side, and there's just 3 of you. Like that's not going to end well. You got to go out with your whole regiment, right? Your whole battalion, or else you're going to lose. So it took 1 week of regular 60,000 a day to get to 62% of the treatment group to have optimal levels of vitamin D. It took 2 weeks before 3/4 were optimal, meaning that even after 2 weeks of 60,000 units a day, still a full 1 out of 4 people were not in the optimal range. Okay, so in other words, you need to work with your doctor to look at the studies, apply the information from the studies, and then appropriately dose the vitamin D early on to protect us from this problem.
Okay.
Dr. Youngberg, there are people that would say that what have toxic effects from this taking vitamin D. How should we approach taking any natural supplements?
All right, that's a very good question, Scott. Here's the key. Most studies that are done with looking at one variable only. That's kind of how the scientific method works. I understand the reason for that, so that you can get statistical power and you're you're actually able to show that this one thing either helped or it did not. Unfortunately, that's not how the body works. The body doesn't work by just one thing. The body works best when it's getting an optimal amount of everything that the body uses to improve the immune system. And so, an optimal immune system is not determined by one nutrient alone. One nutrient alone can dramatically improve the immune system, but nowhere near as powerful as we're optimizing all nutrients at the same time. So for instance, one of the potential criticism, which really isn't valid, and the studies have shown this over and over, is that vitamin D at higher doses could cause calcification, high levels of calcium in the blood, what we call hypercalcemia, and that in turn could be associated with excess calcification of tissues. And we don't want to calcify soft tissues like artery walls and kidneys and the brain. We want to calcify bone, right? And so there's this irony, this paradox we call the calcium calcification paradox, where as we get older, our bones are being demineralized, right? Everybody knows that we, on average, lose 1 to 2% of our bones every year as we get older. That's why the older we are, the more likely we are to have thin and bones and osteoporosis. Well, that's actually preventable if we are aware of this optimal nutrition approach, which you were referring to, Scott, and that is that calcification could theoretically occur if you're taking a lot of vitamin D for a long time, but yet you have deficient levels of vitamin A and vitamin K2, and even iodine for that matter. And so what that means is that as long as we have adequate or even optimal levels of iodine, vitamin A, and vitamin K2, that we're very unlikely to develop a problem with tissue calcification, even though when just using vitamin D, you're not going to show tissue calcification or even elevated blood levels of calcium until your blood levels go over 150. And that's really hard to do. You have to take a lot of vitamin D to get your blood levels above 150. So in summary then, there's 2 vitamins in particular that should be used jointly with vitamin D, especially when we're taking higher doses to protect ourselves, which we should right now, is vitamin A. And so many experts are saying just match the dose of vitamin A to the dose of vitamin D that you're taking. So if you're taking 5,000 units of vitamin D, take 5,000 units of vitamin A. This is like the vitamin A palmitate, or vitamin A, not beta carotene. Not against beta carotene. It's just that many people don't convert beta carotene very well to vitamin A. And if you need the immediate immune boost, you want vitamin A, not beta carotene. So you just adjust it that way. Other people say, well, I've heard vitamin A can be toxic. Well, it's all relative, right? Yes, it can be toxic at high levels. And guess why? It's when you're deficient in vitamin E. Okay, so you don't get toxic levels of vitamin A unless you're deficient in vitamin E or some other nutrient. So that's why you have to have be on a good multiple vitamin mineral supplement and then build on that. That way you're kind of covering the base and then you're adding to it for immune support. And then the last point on vitamin K2, vitamin K2, like vitamin A and vitamin D, are fat soluble vitamins. And so there's this concern, oh no, these are fat soluble, they could be toxic. So therefore we really should kind of not really take those. Nothing should be further from the truth. Vitamin K2 is extremely valuable to our health. It can dramatically lower the risk of heart disease, dementia, okay, and also COVID. Why? Because it's one of those underlying things that helps with the metabolism, with lowering insulin resistance, lowering calcification of the tissues, and optimizing other immune parameters. So, so I tend to recommend to my patients, and again, you should talk to your doctor for this if you're considering this, is, and by the way, never take additional vitamin K of any form if you're on Coumadin or any form of warfarin for anticoagulant purposes, because it will inactivate the effect of the Coumadin, right? So anytime you increase vitamin K, if you're on Coumadin, work with your doctor to see what it's not that the vitamin K is bad, it's you have to balance the vitamin K and the Coumadin or warfarin appropriately. So the vitamin K2, if you're not on Coumadin, would be the vitamin K2 MK7, which is the form of vitamin K2 that actually helps build your bones stronger. And the form that helps remove calcium from your arteries, your brain, and your kidneys. So it helps limit dementia, heart disease, and improves your immune system all at the same time.
Awesome. So we're getting close to running out of time. I did want to ask, because I'm sure this is going to be on people's minds, is, we're supposed to have this vaccine rolling out. In fact, I thought I heard maybe it was going to start rolling out today. Some people may be hoping, well, if I just simply take the vaccine, then my health concerns will be solved. What are the risks in having this attitude?
Hey, I'm hopeful that this vaccine could be helpful, but I'm not holding my breath. Even the top FDA advisors to the vaccinologists have raised some serious concerns because of how rapidly this came out. Normally, it would take over 5 years to develop even a normal vaccine of this nature. And this, in less than a year, they completely skipped the animal trials, right? And that's really concerning because it was in the animal trials with the original COVID vaccines of SARS-CoV-1, where animals who got the vaccine did okay originally, but then developed what we call antibody-dependent enhancement, which sounds like a good thing on the surface, but it's actually a bad thing. It's like basically giving food to the virus, like go for it, and it increased the viral entrance into the cells and was more likely to cause serious infections and death. And so there's a lot we don't know. There is a lot we don't know. In fact, any vaccinologist would be the first to tell you that Operation Warp Speed was because there's so many people have died that they had to do something. They had to speed things up, but nothing compares to optimizing your immune system. Okay, so for somebody to say I'm hearing all this good news about the vaccine, that's all I need. I'm just going to take the vaccine. I'm going to forget about all this other stuff and, taking care of my body and eating right and exercising right and sleeping appropriately and taking these nutrients. I'm just going to get the vaccine. Okay. That would be a horrible mistake. A horrible mistake. We're going to learn that the vaccine may be helpful, but it's by no means the cat's meow. It's not going to solve this problem by any means. The most important way to solve the problem is to get everybody to have a real strong immune system and start dealing with patients who have the underlying complications and treating them in ways that actually reverse the problem, at least begin to reverse the problem.
Well, Dr. Youngberg, as we get close to wrapping up here, what are some fundamental strategies that we can take with us into the holidays? Some key takeaways.
All right. So the challenging part of the holidays is that we have to realize that what we eat has a huge influence on the function of our immune system right now, that day, within the next few hours. And so we could literally eat ourselves into a COVID sickness and a COVID death. Okay. I'm not exaggerating. That's what, with what's happening right now with the lockdowns and people staying at home and basically ordering in, right? And, DoorDash and Grubhub they're just coming to the house. They're over at our house more than anybody else. right? So we have to be really careful with that and what we choose to order. You can order healthy through these methods, but a lot of people are just using it as an opportunity to eat whatever because they're bored and they just want something yummy and they're going for comfort foods. That's the worst thing you can do right now. And I know it's hard during the holidays, but just remember this virus is out to get us, right? And it wants to get all of us. And so if we're not eating healthily, it opens the door for the virus to come right in and begin replicating more rapidly. So that's number one. Number two is after every meal that's healthy, and especially if the meal is less than healthy, we should be going for a walk. Nobody should be afraid to go outside and go for a walk. Nobody. You're safer outside taking a walk than you're in your own house. Okay, why? Because you're improving your immune system. You're getting fresh air. You're hopefully getting some sunlight. You're even early morning and late afternoon light is really good for the immune system and hormonal balancing. So get outside and enjoy the fresh air and the sunshine. There's a lot of research showing that that's really critical for our immune system. And then we have with exercise, don't overdo the exercise, but do it every day. Okay, if you're starting to feel a little under the weather, don't go out there and run 5 miles because then you're just depressing your immune system further. You want to work towards what is appropriate for you from a fitness standpoint. If you're used to running a marathon, then 5 miles is nothing. But if you're only used to running 5 miles, don't go out there and do that again if you're not feeling well. Just moderate your exercise, but do it daily and do it after every meal.
Right. So I know we're about out of time. I want to highlight a few things. First of all, just thank you, Dr. Youngberg. I know everybody really appreciates the wealth of information you share, and we have so much more to share with you. We're very excited to let you know that we're going to continue this monthly webinar series. We have some ideas of what that content's going to be, but we also want to get your feedback. So first I want to say, if you had questions that didn't get answered, feel free to email us at info@brightenheights.org. I think Katie's even put that in the chat window if you want to write that down. And we will work to get back to you and getting your answers to your questions. We also want to let you know our next webinar is going to be January 11th. It's always going to be on a Monday at 4 p.m. Eastern, 1 p.m. Pacific. Same access as what you experienced today, either through Zoom, Facebook Live, or YouTube Live, and then you can always watch the playback in those 3 venues as well. Our topic is going to be a deeper dive, really, why you should care about your health right now. Maybe you're not having any health issues, but Dr. Youngberg is going to go into a much deeper explanation as to why everything we do matters. I think he'll probably get into some epigenetics and explain really about our DNA and how that works. Very exciting stuff. In future episodes, we hope to cover topics such as exercise, sleep, diet, testing, supplementation, and how to go about following your plan. Now, having said all that, if you've joined us, especially I think through Zoom, there is a post-webinar survey that we would really like for you to fill out. It just takes a second for you to click those topics you're interested in, but also there's a box for you to write in some topics that maybe we didn't mention that you would like to have us consider as a future webinar. So again, we want to thank you for your time. Thank you, Dr. Youngberg, again, and we will see you all next time on January 11th.
Take care now. Good to be with you.